everyone, it's Nurse Queen. I am back today with a new video. This video is going to be about labor and delivery nursing. So if you are a new grad looking into a new specialty, if you are a transitioning L&D nurse going to travel nursing, or if you are a nursing student trying to figure out what specialty is for you, this is the video for you. So go ahead and like, subscribe, and comment. We're gonna get right into these labor and delivery misconceptions and tips. Recently made a reel about 5 labor and delivery tips, and I got a lot of good feedback from it. A lot of nurses interested in labor and delivery, or even new grads trying to figure out what specialty is for them. And I got so many questions loaded with misconceptions and also just inspiring words. So this video is an extension of that reel. The reel is on my Instagram, by the way, if you want to check it out. But I'm going to kind of like pull some more information from that just to give you all a little bit more insight on women's health. So misconception number 1, L&D is a soft specialty, meaning that it's an easy specialty and we just literally see babies being born all the time and we hold babies. No, L&D is far from soft. I'm expected to be the L&D nurse, the OR nurse if my patient turns into a C-section, the PACU nurse once my patient gets out of surgery from the C-section, the ED nurse if I am an OB triage, and when I work at high-risk facilities, I am expected to be an ICU nurse because these moms are really sick and they may be on medicine such as insulin drips, heparin drips, different things of that nature, and you are expected to take care of them. So misconception number 1, L&D is not a soft specialty. It is very, very rigorous and it requires so many critical thinking skills. So when you think about L&D being all happy and joyous, that's not always the case. Misconception number 2 is that we hold babies all day. So we do not hold babies all day. Actually, I probably hold babies 10% of the time when I'm at work. My role as an L&D nurse is to assist in vaginal deliveries and C-sections, to induce and augment my mom when they're in labor to have their successful delivery. Now, you know, when the baby comes out, we help the baby transition into life, like such as taking care of them, assisting with breastfeeding. But for the most part, if you are looking to hold babies all day or you feel like that's where you find your passion at, I recommend you all look into becoming a nursery nurse because L&D nurses, we don't do that. Misconception number 3. A lot of people look at labor and delivery as being joyous and happy, and we're running the fields and we're seeing so much life being brought into this world. And although that is kind of what it is, like we do see life being brought into this world, but it is a rigorous specialty. Like you have to assess and monitor a fetus in utero, and you also have to make sure the mom is okay to help bring that baby earthside. So it is very hard and it's not always joyous. We always don't have a positive outcome, or we always don't have like the best case. We have moms who don't unfortunately get to have their babies, or they come in and we have to induce their labor and they have to deliver babies that aren't alive. So it's not always happy. So when you think of labor and delivery, you think it's always joyous and happy, and I just literally see so much life. I do, and I'm very passionate about my specialty, but you know, it's not always that. We always don't see the positive outcomes, and that's just that. So now we're gonna get into some tips. So tip number 1 is if you are a new grad labor and delivery nurse, or if you are changing specialties like I did from med-surg to labor and delivery, things that you need to make sure that you're key on is being able to monitor a fetal heart tracing. Now, you may think like, I don't remember how to do that from nursing school. Don't worry, you're gonna take a class called fetal monitoring, and they're gonna basically teach you how to do so, or just kind of refresh your memory. It's not hard at all, and it's not really hard skill to acquire, but it is vital for you to understand the different methods, the decelerations, and just what's normal versus abnormal, because overall, by knowing that, you're going to be able to safely take care of your patient. A tip that I put inside my reel is something called VEAL CHOP, VEAL CHOP, and basically it helps you categorize the decelerations for heart rate. So I'm not going to go into depth on that. You can actually Google it, but that is a helpful tip that helped me transition from med surg to labor and delivery very effectively. as a labor and delivery nurse, you are expected to check your patient's cervix. Now, I'm not gonna try to go too in depth about that, but it is an acquired skill that's so hard to learn because you have to literally practice. When I say practice, you have to keep on checking cervixes in order to actually get that down packed. Now, I know a lot of nurses work at teaching facilities where they don't check cervixes at all. Like, basically the residents go in and do so. And with that being said, that's a very hindrance process for that nurse, because I've run into nurses who have worked at teaching facilities for probably 10 plus years and they don't know how to check a cervix, just because they have worked at this facility that the residents, the OB residents, the doctors, they do it. So if you are a labor and delivery nurse, you have to learn how to check a cervix, especially if you are planning to do travel nursing, because at most facilities, you are the first line of care and you are expected to know how to assess the cervix to then help the patient's plan of care, whether you're inducing them or augmenting them. So my tip for helping you all learn how to check a cervix is get something called a cervix dilation board, and it's basically a bunch of little circles on the board, and basically it helps you measure. So when you go in to check the cervix and you put your finger out, if your fingers are open, you'll basically put it on the board and you'll compare it. Soft tip on how to check a cervix: make sure that you all do not have long nails. So as you all can see, my nails are very long. That is not comfortable for any woman, that's not comfortable for any patient. I'm currently off of work, so they're long, but make sure you have shorter nails, preferably, you know, very short nails, to check your patient. Okay, when you check your patient, make sure they are relaxed. While they're relaxed, that's going to help you assess easier. Once you actually go in to check the cervix, you're going to literally put 2 fingers in the cervix very gently with lube on your finger, and once you get in there, you're going to use 1 finger to kind of guide around the cervix. And once you find the hole of the cervix, if there is one, if she's open, you're going to kind of feel like a dimple if she's like a fingertip or closed. If it is open, you feel for that hole. Okay, it's open. You're going to guide the other finger in there, and you're going to open your fingers to where she's at. Once you pull your fingers out, you'll be able to assess way more easier. But a difficult thing I had was actually finding the cervix. Like, everything felt the same in there. So once you actually feel the cervix and find it, you're gonna literally be so happy, because it's gonna be a game changer for your skill set. Next tip is make sure you all know how to start an IV. Now, a lot of new grads don't know how to start IV, so practice makes perfect. But in labor and delivery, we are expected to use the largest gauge, so either 18, in some hospitals a 20, but we want the largest gauge because moms lose a lot of blood. So in an event they need blood, you need a large gauge needle in order to give blood effectively and rapidly. So with that being said, make sure you all are gaining as much experience on starting IVs and drawing labs, because you are going to be the first person the patient sees. You don't get your patients from med-surg, you don't get them from ED, and if they do come from ED, they don't start the IV. So you are expected to know how to start an IV and also draw labs. And sometimes moms come in 10 centimeters, they still need an IV, and they're actively pushing, their baby's head is crowded, and you're expected to start an IV on them while they're doing all of this. So gain that skill, grasp the concept, and, you know, go out there and start an IV and do your thing. Next, this is for my travel nurse babes, or the babes looking to go into travel nursing for L&D. The hospital I came from, I did not have to set up my vaginal delivery card. It was always the tech's job to do so. So when I started traveling, I literally didn't even know how to start or even set it up. So my advice to you all is know how to set up a standard vaginal delivery cart. By doing so, you're going to be able to be more marketable. You're going to have more skills when you go into these other travel assignments. So by setting up the vaginal delivery table, of course it's doctor preference, but make sure you all know how to do that, or even snap a picture of a standard vaginal delivery table at the facility that you're at, just to get an understanding of what is what. A quick tip is clamp, clamp, cut. Make sure you have the clamps and the scissors next to each other for the doctor, and always, always, always have a bulb suction on your table. That is a vital tip I had to learn the hard way. Lastly, but most important, make sure you all are flipping your patients in different positions. Now, positioning is key for labor progression. A lot of people and a lot of my friends who have had babies, or people that I know who have babies, they say that they laid in the same position the whole time. Their nurse started medicine and eventually they had like 3-day inductions. No, like that's not cool. Like, you need to make sure that you're flipping your patient in different positions. Like I tell all my patients, you cannot have a baby flat on your back. So let's get into some of those positions that you all got pregnant in. I posted that reel and I have like pictures of different positions that you all can put your patients in. Make sure you all are utilizing that peanut ball, especially after your mom gets the epidural, because it's gonna help her labor process so much. And advocating for your patient and doing that is going to be a game changer in her progression. So positioning is key to labor progression, especially for my new grads. Make sure you all are safely doing that. Ask them what the appropriate positions are, because it's going to help make your patient's labor so much easier and help her meet her baby sooner. So thank you all for watching my quick labor and delivery tips and misconception video. I am going to be making more videos. Like, comment, and subscribe on some topics because I'll be dropping them pretty soon. Bye. Thank you all for watching.